A family in Nairobi is caught between complying with COVID-19 burial protocol that requires them to bury who died from the virus with 48 hours and a demand by hospital for 3.8 million shillings bill before the body is released. Enoxikolia reports.
The family of the late Adams Mbugua Kimani is in between a rock and a hard place. Kimani succumbed to COVID-19 last Saturday while receiving medication at the Aga Khan University Hospital. The family now struggling to raise 3.8 million shillings as hospital bills.
We have to pay the bill. Of course, we have to clear that bill, 3.8, of which are 2 now.
The music producer was diagnosed with COVID-19 on the 13th of June while undergoing treatment at Metropolitan Hospital in Buruburu Estate in the county of Nairobi. He was then referred to the Kenyatta University Hospital for management. And with his health deteriorating, his family decided to have him transferred to the Aga Khan University Hospital.
Ni kama mtu anajua alikuwa anataka kuenda akasema kama sita make niangalie watoto vizuri.
A day after admission at the Aga Khan, Adams was taken to the intensive care unit.
So alikuwa na need a lot of oxygen through hizo machine. But ile answer alikuwa anatupatia alikuwa anasema okay, he was critical.
Strict quarantine orders and prohibitions on visitors at the Aga Khan Hospital left this family feeling anxious and helpless. And after days of battling COVID-19, Adams died alone in the ICU. His death last Saturday left his family in huge debts. The money he had in his account had already been deposited with the hospital upon his admission. But his hospitalization had accrued a bill amounting to 3.8 million shillings. The family now forced to run up and down to foot the bill to comply with the burial protocol for those who die of COVID-19. The protocol dictates that burials must take place within 48 hours of death. It's a week since Adams died and his body is still lying in the mortuary. The family cannot afford to pay the medical bill.
Sasa tulienda tukajadiliana nyumbani tukaona tuache title na sisi hatuna hiyo title. Hiyo title ni ile iko Gertrude Hospital ya ule mtoto special. Bado kuna bill nyingine iko huko.
The government says it's ready to intervene in situations where families are unable to pay hospital bills in private facilities.
We are under very difficult times and they need to be very considerate when they're dealing with people who will be affected by COVID and end up dying.
The government has outlined the cost of treating COVID-19 in private facilities. According to the Director General in the Ministry of Health, Dr. Patrick Amoth, treating an asymptomatic patient will cost 21,300 shillings per day, while a patient with mild symptoms will cost 21,400 shillings a day. The cost of treating a COVID-19 patient in the ICU but on supplementary oxygen is 51,000 shillings a day. But the treatment of patients in ICU and placed on a ventilator is 71,000 shillings per day. Enoxikolia, Citizen TV, Nairobi.